So what happens if you already have OCD and then you get a brain injury? What happens to the symptoms? Do they get worsened? Do they get better? And do you have new symptoms now because of the brain injury? Well, let's start off by talking about what is a brain injury. A brain injury is a trauma to the brain sustained by either a sudden stop or change in position or an external force that impacts the brain itself. And typically, this results in changes to an individual's physical, emotional, or even mental way of being. Sometimes these symptoms are short and recover, and sometimes they last long term for the rest of the individual's life. And this depends on severity and the type of trauma sustained. But what if you already have a mental disorder, a mental illness such as OCD? Well, studies have shown that most individuals that already have a mental disorder prior to the brain injury can experience their symptoms to get worse. Now, this can be for a short period of time or can be long term. Now, the interesting part that some individuals can actually experience symptom attenuation. And what that means is that their symptoms may actually even get slightly better. Now, this all depends which area of the brain is affected. Now, the important part to note is that OCD is a psychiatric disorder. Okay? Now, some individuals with a brain injury can experience a neurocognitive disorder in which they develop symptoms that are similar to OCD. So it's important to know what is the difference, and even more important, to get proper diagnosis so you can get the proper treatment. So symptoms that can happen after a brain injury that look like OCD. This can be things such as repetitive behaviors or even what looks like paranoia. But rather than something coming from a psychiatric disorder, it comes from the impact of the injury. And oftentimes, things like memory difficulties or problems with attention can cause an individual to develop different compensatory behaviors, ways of dealing with these deficits that are not very functional and can look like things like OCD. They may start to do things in a repetitive manner, become very, very structured in the way they go about their lives, becoming irritable or very reactive when that structure is violated. Now, the reason they become structured is because they no longer have the mental capacity to remember things or process things like they used to before the brain injury. Now, it's important to note that most of the common treatments for the psychiatric disorder OCD are still used to treat individuals with brain injury that experience these symptoms. The problem is that the treatment is not as effective. So proper diagnosis and follow-up with a specialist is very, very important. And this means seeing someone who specializes in the treatment of both of these disorders. Someone like a neuropsychologist or neuropsychiatrist are very important. Make sure to follow us for more information on this very, very important topic.